Now turning to coronavirus, the nation is setting a record high for COVID infections, and this comes as the CDC updates its quarantine period. Eyewitness News reporter Zach Briggs on what you need to know.
Most of the data show that COVID transmission occurs early in the course of illness, and so they feel like that probably happens mostly within the first 5 days or so of infection.
University Health's Chief Medical Officer, Dr. Brian Alsip, cites the CDC, saying that infected individuals should isolate for 5 days instead of the previously recommended 10. For those who've had close contact with an infected person, quarantine is also reduced to 5 days. People who've gotten the booster shot can skip quarantine if they wear masks for at least 10 days.
Even though they shortened the physical isolation duration times, they really think people could still potentially be at risk. And so really that mask is important for protecting yourself and protecting others.
When we lose somebody to an illness or an injury or anything, it's a percentage point for us, right? It really moves the needle.
John Hewson, CEO of Frio Regional Hospital, says the CDC's updated guidance is bound to provide some relief.
We have recently had some staff that have been impacted by COVID, and the thought of losing them for 10 days is always a scary place when we already have holes on the schedule and it's difficult to make sure that we're staffed appropriately. But reducing that now is something that will benefit us.
Meanwhile, there are doctors nationwide that have taken to social media expressing concern over the potential for high transmissibility of the virus with shortened isolation times, especially when it comes to the unvaccinated. And as always, the CDC emphasizing that getting vaccinated remains the best way to protect yourself and others from the virus. Zach Briggs, KENS 5, Eyewitness News.